So, hello, ma'am. How are you?
I'm okay. How are you?
Good. So, what exactly is your name?
Larisha Hill,
And where do you work?
Walgreens Pharmacy.
And what do you do at Walgreens?
I'm a senior technician.
So, this interview is about evidence-based practice and how do you do evidence-based practice at your job. So, do you know exactly what evidence-based practice is?
Oh, yeah. It's where you base a lot of the practices that you use in your field on the evidence that's been collected.
Okay. So, how does evidence-based practice impact your field specifically?
A lot of the practices that Walgreens has come from, evidence that they gained over the years, like what works best for the patient and the employees and just the company overall.
So, can you provide a specific example of evidence-based practice that you utilized?
I can. So if you've ever picked up prescriptions at Walgreens, at the end of your transaction, you probably noticed that the person checking you out asked you if you have any questions for the pharmacist. That's because there's evidence and statistics that show that only 12% of adults know about the medications that they're taking or, any health literacy at all. So we make it our mission to ask them, do they have any questions in case, maybe the doctor didn't explain it or, maybe they didn't. A lot of people just don't know. They don't think to ask. They just take it.
Makes sense. That makes a lot of sense. So, what is your organization's process for adopting best practices or evidence-based practices?
We keep a lot of data, like going with the patients, like anything that happened, if they've gotten the wrong medication, if this medication interacted and maybe that's not something on file that we have as an interaction, or maybe they got a different patient's information. Whatever the problem is or this thing is, we put it in the system, we send it to our corporate, and from that then on, they send us back a message, and every person that was involved in that situation or that interaction has to read over that, and then they tell you how you can better it or what you shouldn't do next time or what you should do next time. And then sometimes the policies do change from just one interaction on for everybody in the pharmacy.
So how do you determine if the practice actually works as it's intended?
Basically, if the practices work, we keep the policy the way it is. It doesn't change. A lot of times, if it doesn't work or it's just basically trial and error, that policy will change a lot. So we're just basically trying to better it every day.
So do you see this effective every day at work?
Yes, every day.
Do you appreciate the policies that they have in place?
Yes, I do. Because a lot of it, like asking, do you have a question for the pharmacist? They probably don't even realize they have a question, but you asking that question make them think that maybe they do have a question. So then they go further to ask questions.
That makes a lot of sense. So what if they don't feel comfortable asking their pharmacist questions? Who do you think they should call?
If they don't feel comfortable asking the pharmacist question, I would just say a lot of the information for whatever drug that they're taking or anything like that is on the leaflet, on the paper that you get with your prescription. It tells you all about that drug and even the side effects, what other drugs, can interact with it. And then it'll tell you, common side effects. So something that you might see, but it may be normal when taking that medication. But if they don't read that, because a lot of people just throw it away, don't take the time to read it, they could ask their doctor. If they feel comfortable with their doctor, they can ask them for more information. Or call the pharmacy.
Talk to a pharmacy tech such as yourself.
Yeah, I'll be happy to help them.
Well, I appreciate that you're happy to help. So, well, thank you, ma'am. I appreciate all your time and your information. And I hope that these policies continue to be in place and we can improve health literacy and drug use literacy. Thank you, ma'am.
No problem.